welcome to Asian Digest on ATN. I'm your host, Damon Dillon, and if you're like me, you've probably experienced some allergy symptoms like sneezing, runny nose, dry, itchy eyes. Well, sometimes we misread these symptoms to think that we've got a cold or a flu, but sometimes these symptoms can actually mean we're suffering from an allergy, like ragweed allergy or any other allergies that affect us at various times. So folks, how do you figure out if you're actually suffering from a cold or a flu or from an allergy? Well, today we're going to hopefully answer those questions for you. Today we've got the official representatives from Inflamax Research here, world leader in allergy and asthma research. I'd like to welcome to the show Justin Buck and Sakshi Sharma from Inflamax. Hello, you two.
Hi, thanks for having us.
Great to have you. And I think this is like the perfect time to have this show because I know hopefully your viewers are like me. I'm always sneezing or something, right? And so I'm always like, oh, it's the weather. Like, there's something happening, especially this year, right? Can't figure out if it's going to be spring or summer or winter still. So let's actually answer this for our viewers that, maybe are suffering from some of these symptoms. So actually, let's start off with you. So we just mentioned there's, runny nose, right? Dry, itchy eyes. Everyone's experienced that. How does one actually figure out if they have a cold or if it's actually an allergy?
That's a really good question because a lot of the times the symptoms do overlap. But there's a couple of ways that you can tell if it's an allergy or if it's a cold. First of all, if you have a fever or a cough, you probably have a cold. That usually doesn't accompany an allergy. With allergies, you're going to get those symptoms that you mentioned before. You're going to get like sniffling, sneezing, itchy, watery, red eyes. Also, you can pay attention to the timing to know if it's a cold or an allergy. Colds will usually happen during the winter time, and allergies can either happen during the allergy season if you're allergic to that particular allergen, or it can happen year-round if you have, say, a cat allergy and you live with a cat. As long as you're around the cat, you're going to experience those symptoms. So if you actually pay attention to when your symptoms start, you can get an idea of what you're allergic to. So if your symptoms kind of start in the beginning of summer, so as soon as it starts getting warm, the trees are going to start releasing their pollen. If you start getting symptoms, then you're probably allergic to trees. If it happens kind of later in the summertime, then you're probably allergic to grass. And if it happens kind of towards the end of the summer, August, beginning of fall, you're probably allergic to ragweed. And again, if it's something that's happening constantly throughout the months, then you might be allergic to dust or an animal that you're living with.
A very good point. And actually, we'll talk about this later in the show. It can develop as well over time because I know sometimes people think like I should be having these symptoms since childhood, right? But people can actually get allergies, especially the ones to pets. I know that as well. So Justin, let's get you a jump in here. So Inflamax Research, some of our viewers might not be familiar. So can you maybe talk to us a little bit about the company and how do you basically help people with allergies and asthma?
Sure. So Inflamax Research is what we call a CRO, or a clinical research organization. Essentially, we are helping bring new effective allergy and asthma medications to the Canadian marketplace so that they are available for people, for example, over the counter in the pharmacy. So specifically what we do is we work with companies who have a new idea for a product and they want to see if it is effective against the allergy symptoms or asthma symptoms. So they would come to us and they say, we have a new product and we would like to eventually try to get it into the Canadian healthcare marketplace. So essentially they would come in and say, we have this type of drug, there's this type of medication, and we would design a study for them, and that would include bringing in participants who have ragweed or other allergies, whatever the study may be. And what we do is we measure the symptoms before getting the medication, we administer the medication, and then we check their symptoms after.
Very cool. Now actually there's an opportunity coming up, speaking of researching, so you're actually inviting ragweed allergy patients to participate in your allergy research study. Folks, make a note of this. It's both in Toronto and Ottawa. Anyone who has ragweed allergies can participate and earn some money. So tell us about that. Basically, how do people get involved?
Sure. So, well, they can get involved by checking out our website, www.sneezetoronto.com.
Love that URL.
Sneeze, just like you're sneezing. So anytime you sneeze, head over to the website. So that's how you start. And the study is approximately 8.5 to 9 months long. It's starting right now, end of March into early April. And what you're going to do is you're going to come in and we're going to test you for your allergies. So we need to make sure that you do in fact have the ragweed allergy. So if you do have it, we would start you in the study, and again, it's approximately 8.5, 9 months. In the beginning phase, we're going to test your symptoms. So we're going to see if you actually do have the symptoms we're looking for, the runny nose, the itchy eyes, the sneezing, that sort of thing. Then, if you do, we would put you into the treatment phase of the study, which is approximately 16 weeks long. You're going to come in once every 2 weeks. It's not a very long time commitment for that phase. It's about an hour, hour and a half every 2 weeks. Then you're going to go through the actual allergy season, and we're going to get you to record your symptoms. So we know your symptoms before, and then we're going to ask you to do them during the season, so we see, are they the same? Is the medication doing what it's supposed to? Is it lowering your symptoms?
Okay.
Then at the end of the study, we're going to, again, outside of ragweed season, test your symptoms to see if the medication did continue to work.
Okay, I'm definitely going to get more into details on that because I know we're kind of going general, but I know our viewers, they always want to know right into the details. So we got to take a little break, so definitely we'll get back to that. Folks, don't go anywhere. We'll be right back after this short commercial break. Welcome back, folks. I'm your host, Sam and Dylan, still chatting with Justin and Sakshi from Inflamax Research. Well, Justin, you were actually explaining to us how our viewers can actually participate in an upcoming research opportunity and earn some money. Now, you were just explaining with the ragweed allergy, a little bit overview of, coming in and finding if you have it and then participating. I'm sure viewers are, like, most people don't know if they have the allergy, so I'm sure they have this image of having, people prodding them with, like, needles or whatnot. So maybe just explain to us of how do you actually determine if someone has an allergy or not?
Sure. The test is called skin prick test. It's a standard test among all allergists. Essentially what they do is they take your forearm and they take a little, it's just a little piece of plastic with a sharp end that has the allergen on the end, and they do a short little scratch. After a period of time, there's a little bump that comes up, and they measure that bump. Based on the size of that, we can tell you if you have the allergy or not.
Okay. And do we care, like, is there a certain degree of an allergy? Like, because some people are kind of sensitive and some people aren't. Does that matter?
So the way it works is, essentially, it's based on a measurement based on the study protocol. So the whole protocol of the study tells us what to look for.
Okay.
So these protocols are designed by doctors and allergists and experts in the field. So what they say we are considering to be allergic, that's what we're looking for.
Okay, and so just recap, how long is the study again?
So the whole study from start to end is approximately 8.5 to 9 months. So it starts now and it goes until about the end of October, early November.
And it's both in Toronto and Ottawa, but we want to make sure our viewers know that they need to come in, right, once a week or so for the research, right?
So the way it works, yes, we do have clinics in Ottawa as well. Just as well, we also have open clinics in Windsor, London, and Oshawa, Ontario, as of this week. And so you basically give us a call, and we would say, depending on where you are in Ontario, we would direct you to the closest clinic. You're going to go in there, and they're going to do all the screening to see if you are eligible, to see if you do have that allergy and you are a healthy person. After that, all the details are given at that visit, so you know exactly the time commitment. Approximately 45 to 50 hours is the total time commitment, but again, spread over 8.5, 9 months.
Yeah, very doable.
Yeah. So after you do the screening, we're going to tell you if you do pass, and if you do pass, we're going to invite you back for that treatment phase. And again, that's about 16 weeks. It's about 1.5 hours every 2 weeks. Then you're going to go through the ragweed season. Again, you're going to be answering questionnaires based on how you feel in your daily life. Are these things affecting how you do your daily tasks? Then at the end of that, we're going to do what they call an allergy challenge, where outside of the ragweed season, we're going to elicit your symptoms. So essentially, you go into an allergy room, we call it an EEC, and there's going to be allergen in the air. So it's just like being outside, except you're inside with the ragweed in the air. And we test your symptoms again just to see if that medication that we gave you is actually doing its job and being effective to treat your symptoms.
Very cool. So not only do you get to help yourself and hopefully other Canadians, but you make some money too, right?
Yeah, so the compensation for the entire study, if you complete beginning to end, is $5,000. If for any reason you drop out halfway through, you're paid up to a prorated amount of the pieces that you completed.
Perfect. So, so just to clarify, so let's say somebody does participate and something happens and halfway through they are able to leave the study and get a little bit of compensation, but they are able to leave, because I'm sure people are like, am I signing away my life here? So just to make sure that we clarify that, right? So I'm sure the next question people are wondering is it safe to participate?
So safety usually comes down to people asking, are there side effects?
Yes.
What are the side effects?
Am I going to get more hair? That's my question.
I would join that study, let me tell you. Essentially, with the side effect question, if you take an over-the-counter medication like Tylenol or Advil, there's always chances of side effects, okay? It's Inflamax's mandate that every procedure, every piece of the study that is done, it is monitored by medical professionals. We have doctors on staff, we have medical associates, we have a whole medical team looking after you during the study. Some people even say that when you participate in a study, you're actually being monitored more closely than you do when you go to your family physician once a year. So we are watching you every step of the way and making sure that your safety and health is the main concern.
Very cool. Again, for people that have never done a study or whatnot, I feel like it's quite common. Like, I mean, I don't want reviews to be like, oh, I don't know. It seems like, like not many people do it, but it's quite common across Canada for people to participate not only with allergies, but in other research studies as well, right?
Well, let me give you just an example. In our subject database, we have over 80,000 participants.
Wow.
And
so
again, we're in Mississauga.
Yeah.
So it's a very common thing. There's ads on the radio for many different companies. There's ads in the newspapers for many different companies. We ourselves are on literally every radio station within the GTA, Toronto, Southern Ontario area, and we're always looking for new participants.
That's why you two sound so familiar. Always on the radio during the commercial breaks. Well, fantastic. Lots more, of course, to talk about. This is very interesting, but we got to take another break. So, folks, don't go anywhere. We'll be right back. Welcome back. I'm your host, Sam and Dylan, still chatting with Justin and Sakshi here. Of course, we talked about this great research opportunity that's coming up. People have the chance to make up to $5,000, right? If they've got ragweed allergy, and hopefully help themselves and the Canadian market. Let's let our viewers know a little bit more in terms of where you guys are located, how do they get information? Maybe, Justin, do you want to let us know?
Sure, yeah. So our headquarters is in Mississauga, Ontario. It's just off the 401 on Dixie Road. Our exact address is 4500 Dixie Road, Mississauga. If you want to get a hold of us or learn more about the studies, all of our studies that we do are posted online on our website, sneezetoronto.com. You can check out more information about the company at www.inflamaxresearch.com. That talks about who our executives are, our medical director. He's experienced in allergies for 25 plus years. He started other research companies as well, so he is extremely well versed in the whole Canadian research area, as well as he's a world-renowned allergist. So your allergy care is in good hands when you come to Inflamax.
Very good. So actually, because your company has been around, I'm sure there's many sort of medications that are out in the market that have been results of your research study. So maybe talk to us a little bit about other things that you've worked on before.
Sure. So at Inflamax, and all of the executives at Inflamax have been working in the allergy research world for quite a while now. And with that, a lot of the products that you actually see and buy at your pharmacy that are over the counter have been through the Inflamax stores. So participants, just like the ones we're hoping to get for this study, have come in previously, done the testing, participated in a study, and then based on that data that they provided, they actually helped get that medication to the pharmacy shelves so that other people can get the benefits of taking that medication.
Very cool.
And I think it's what we're really focusing on right now is two parts. First of all, treating symptoms better. So, I mean, I know I have tons of allergies. It interferes with your daily life. So we're trying to find treatments that are going to help more people and be more effective. And on the other end, we're actually trying to help find a cure or a vaccine so that you don't have those symptoms in the beginning. And I would say that the industry is making a lot of progress on that level.
Definitely. And it's also, it's funny because you would think with allergies, people think they're not that much of a nuisance. It just seems like it's minor compared to other health problems, but it really can affect your day-to-day. Like, I even know my line of work, if I've got an allergy going on, it definitely disrupts my day. Maybe just talk to us a little bit about, in your line of work, allergies also, they change as our environment changes, right? Like, I feel like, when you talk to the last generation to this generation, like, there's new things that are being introduced that change even how people react. So it seems like you always will have to keep your research studies evolving to adapt to that, right?
Absolutely. With climate change, allergies are changing. The seasons are getting longer, especially for ragweed. Also with, increased pollution. all these factors impact how people suffer from allergies. And I know that I can comment from my parents. They're born in India, never experienced allergies, and every season my dad is just so miserable. And it's something new in his life. He's in his 50s that he has to now deal with. So, I mean, I'm definitely very passionate about what we do, and I do believe that we help a lot of people.
Fantastic. And it's all based on people participating, right? So maybe, again, we can tell our viewers why it's so important to come out to these things. I mean, yes, it's great that you're getting compensated, but it's also actually helping themselves out and everyday people, right?
Yeah, I mean, the goal of clinical research in Canada is to provide new, innovative, and effective therapies and medications to the Canadian people. It's a very regulated industry. The government is on top of every research study that happens. They have to approve every research study that happens. So before participating, you're going to ask yourself, who actually read through this and says that it's okay for me? Well, I can tell you, the Canadian government did, as well as an independent ethics committee. So all of our studies have to be checked over by doctors, lawyers, people who are knowledgeable in the field of ethics, as well as lay people. So just people who work regular jobs in the community. All of these people join these boards, and they get to read all of the research before it ever happens, and they have the final say of, yes, this is okay to do.
There we have it. So very well planned out research study, I should say. So fantastic. So let's let our viewers know again. So Toronto and Ottawa, and you were saying there's some ones that are...
Yeah, Windsor, London, and Oshawa just opened up as well.
Perfect. And so people can go to the fair URL that we have.
Sneezetoronto.com.
Love that. Sneeze Toronto. And deadlines. So to sign up, what are the deadlines to do that?
So we're actually recruiting for the study right now. The absolute last possible day you can call us and come in to see if you're eligible is going to be about April 23rd.
Okay. And then it starts right away.
Yeah, so essentially we're going to be doing the allergy testing right up until that point. After that, that's our cutoff. Perfect.
Well, thank you so much, you two, for coming in. Is there a phone number as well that we can try to contact you at?
Yeah, so you can call us toll-free anywhere in the country or Ontario, 1-888-989-1808, or you can call us if you're local at 905-282-1808.
Perfect. Well, thank you so much and good luck. I actually look forward to reading the study, which of course everyone can do for past studies and for this on your website, Sneezetoronto.com. Love it. Well, thank you again for coming in, and folks, that's it for today's episode. Thank you so much for tuning in. You've been watching Asian Digest on ATN, and I'm your host, Amin Dillon, signing off.